Good day everyone! I'm Giselle B. Esteban, student nurse, and now let's find out what is these two antipsychotic drugs, the clozapine and asenapine. What is clozapine? The drug name, the generic name is clozapine, the brand name is Clorazil, the generic classification is antipsychotic, and the specific classification is the benzapine derivatives. The mechanism of action. The mechanism of action is unknown, binds selectively with dopaminergic receptors in the CNS and may interfere the adrenergic, cholinergic, histaminergic, and serotonergic receptors. The route, dosage, and frequency. The route is per oral. Adults initially 12.5 mg PO once daily or BID and adjust dose upward by 25 to 50 milligrams daily if tolerated. 300 to 450 milligrams daily by end of 2 weeks. The indication is to treat schizophrenia and schizoaffective disorder. Contraindications. The drug is contraindicated in person with hypersensitive to clozapine, myeloproliferative disorder, history of granulocytosis, uncontrolled epilepsy, and paralytic illness. The common adverse effect of the drugs. We have weight gain, dizziness, tremors, fast heartbeat, headache, drowsiness, nausea, constipation, in dry mouth, increased salivation, visual problems, fever, and increased sweating. The common nursing responsibility in administering clozapine drugs. Monitor patients with diabetes regularly. Rationale, drug may cause hyperglycemia. Monitor patient for metabolic syndrome. Rationale, the drug may cause hyperglycemia, weight gain, hypercholesterolemia, hypertriglyceridemia. Monitor patient for signs and symptoms of myocarditis and cardiomyopathy. Rationale, in patient with CV diseases, the drug may cause chest pain, tachycardia, hypotension, and hypertension. The common client teaching in administering clozapine drugs. Complete full risk assessments and tell patient to rise slowly to avoid dizziness and to immediately report feeling faint, loss of consciousness, or irregular or slow heartbeat. Inform patient that smoking may decrease drug effectiveness. Tell patient to check with prescriber before taking alcohol or over-the-counter drug. Now, we're done in studying clozapine drugs. Let's proceed to another antipsychotic drugs, which is asenapine. What is asenapine? The drug name. The generic name is asenapine. The brand name is Sapris. The general classification is antipsychotics, and the specific classification is dopamine serotonin antagonist. The mechanism of action is unknown, may block dopamine and 5-HT2 receptors. The dosage, route, and frequency. Schizophrenia, 5 mg sublingual twice a day and may increase up to 10 mg sublingual twice a day after 1 week. In bipolar, adjunct to lithium and valproate, 5 to 10 milligrams sublingual twice a day. The indication is to treat schizophrenia and bipolar I disorder. Contraindications. The drug is contraindicated in patients with known hypersensitivity and in patients with severe hepatic failure. Hypersensitivity reactions may occur as early as the first dose. The common adverse effect of the drugs. We have akathisia, drowsiness, extrapyramidal reaction, headache and dizziness, gastric hypersecretory conditions, hypoesthesia, cyalorrhea, and weight gain. The common nursing responsibility in administering asenapine drugs. Monitor patient for tardive dyskinesia. Rationale, this may occur after prolonged use. It may disappear spontaneously or persist for life, despite stopping drugs. Monitor glucose level closely. Rationale, drug may alter glucose control in diabetics. Monitor complete blood count frequently during first few months of therapy in those with history of leukopenia or neutropenia. Rationale: if white blood cell count decreases, monitor patient for signs and symptoms of infection. The common client teachings in administering asenapine drugs. Instruct patient to peel back colored tab on tablet pack, gently remove tablet, place under the tongue and allow to dissolve completely. Warn patient to avoid activities that require mental alertness, such as operating hazardous machinery or operating a motor vehicle, until drugs effects are known. Warn patient against exposure to extreme heat because drug may impair body's ability to reduce temperature. Now we're done in studying these two antipsychotics drugs. Thank you for listening for this simple drug study.